disorders of personality. There we go, disorders of personality. So let's take a look. Look at the outline here. So we're going to talk in general about what it means to have a personality disorder. Then we're going to talk about the really important book that has all the clinical criteria in it. And if you look, there are 3 clusters of personality disorders. There are 10 total personality disorders, and there are 3 clusters that they fall into: erratic, eccentric, and anxious. So you need to know the name of each of the clusters and then which personality disorders fall in which cluster. Okay? All right, first of all, let's start the chapter by talking about, in general, what does it mean to have a personality disorder? So this is an enduring pattern of experience and behavior that differs from the expectation of the individual's culture. So obviously it has to be culture-based. What's a personality disorder in one culture isn't in another, so it's from the expectation of the individual's culture. So this is going to be a disorder that involves impaired social relations, trouble getting along with other people. And personality disorders are different than other psychological disorders that would be diagnosed also with the DSM-5, in that personality disorders, which we're going to talk about, in addition to suffering themselves, persons with these disorders frequently make those around them uncomfortable, and that's why they get the diagnosis. You'll see most of them are not going to seek a diagnosis or even seek help oftentimes, but other people around them encourage it for various reasons, and when we go through the disorders, that will make much more sense. So now again, this is a separate type of disorder than mood disorders, psychotic disorders like mood disorders, depression, anxiety, bipolar disorder, all of that. It's different from anxiety disorders. It's different from psychotic disorders like schizophrenia. It's different than substance abuse. These are very specifically about behaviors that somebody exhibits, and it sets them apart from others in their same culture for various reasons, and that will determine which of the disorders they would fall into. The book, the Diagnostic and Statistical Manual of Mental Disorders. If you look at the little acronym here, DSM-5, so you need to know what this book is called. You need to know the abbreviation or the acronym for it. It is a super important book in the field of psychology. Anybody diagnosing somebody, any clinician, any therapist, any clinical social worker has this book in their desk at all times. This is the manual used for diagnosing and describing mental disorders. And it includes personality disorders, but all of the mental disorders are in the DSM-5. There are about 250 disorders in the DSM-5. We're going to focus on this group of 10 personality disorders. Now, the one thing about treatment I wanted to bring up too, that's kind of the not so great news about personality disorders, is that people who actually have these diagnoses don't respond well to typical therapy, talk therapy, psychotropic medicine that they would get from seeing a psychiatrist. Those do not work well with personality disorders. That's kind of the not good news about these. But let's look at them, and we'll start with the erratic cluster. And what that cluster is looking at is ways of being unpredictable, violent, or emotional. Erratic, unpredictable, violent, or emotional. That's what they mean by erratic. People with one of these disorders tend to have trouble with emotional control. And of course, they have specifically trouble getting along with other people because of their unpredictability, violence, and emotional instability. So the erratic cluster will start with the disorder called antisocial personality disorder. This person has a general disregard for others, cares very little about the rights, feelings, or happiness of other people. And you may have heard them referred to, so this is a term that you would think of when we're in this disorder section, you may have heard sociopath or psychopath. Those terms are actually more research-based. They're not a diagnosing term. Nobody gets diagnosed as a sociopath or psychopath, but you might say that an antisocial personality disorder, a person who has that, displays very psychopathic tendencies. But the diagnosis itself, you would use the term antisocial personality disorder. Again, these are people easily agitated, assaultive, impulsive, irresponsible, superficially charming, indifferent to the suffering of others. That lack of empathy is definitely a part of antisocial personality disorder. So these are individuals typically that have a childhood full of behavioral problems. That's what research is showing us. If a child has not exhibited any signs of conduct issues up to about the age of 16, it's actually looking very unlikely that they will develop antisocial personality disorder. Early onset of severe behavioral problems, it's correlated more with developing this disorder as an adult. What are some of the common behavioral problems of childhood? Often violating the rights of others, like stealing, breaking age-related social norms, like smoking or fighting very early, often having a history of cruelty to animals, lying, destroying property, that would include things like fire setting, and being aggressive to younger children. So kids who have those behavior problems, as those children grow up, these problems tend to worsen if it's going to turn into antisocial personality disorder, because now these young adults commit crimes, more severe crimes. They become more violent. They do more careless, violent actions against others. They might rape or be excessively cruel to others. They have little concern for what they've done. They completely lack remorse. And you'll often hear the term cold-hearted when talking about this group of personality disorders. By the time they're diagnosed with antisocial personality disorder, they have all of those behavioral issues going on, plus they make rash decisions. They make impulsive decisions, and those decisions often go against social norms. Like they'll make rash decisions to rob other people, like on the spot. They often drive while intoxicated. Research showed that happens quite often. They have unprotected sex. They have multiple partners for sex. They don't worry about the consequences. And because they can be superficially charming, the term con artists can be appropriate. You'll often hear that used. They can be smart, and this can make them more successful in hurting other people. And they can make good first impressions, and therefore they fool people quite easily. And that can have disastrous results. There have been serial killers that have been very specifically described as being charming, and they fooled people up, and it was a very disastrous outcome for those. These are people that don't have any problem taking advantage of others, swindling, hurting, killing. They lack guilt and remorse. We said in Chapter 3, when discussing the 5-factor model, back in Chapter 3, that people low in agreeableness are cruel, unsympathetic, harsh, and aggressive. They exhibit many of the tendencies that Eisnick, back then in Chapter 3, referred to as psychotic, too. So these are very similar tendencies that we're talking about now. And we tend to see this cluster in serial killers. Not every person with antisocial personality disorder is a serial killer. They're just not. But all serial killers would meet the criteria for antisocial personality disorder. All right. The next in the erratic cluster is called the borderline personality disorder. Okay, so the life of someone with borderline personality disorder is marked by instability. They have relationships that are unstable, their emotions are unstable, their behavior is unstable, and even their views of themselves unstable. And by the way, this has nothing to do with intellectual functioning. We're not talking about that borderline issue. This is truly a personality that is so unstable, they actually call it borderline, in that these are people who are aggressive, emotionally intense, dramatic, have a poor sense of who they are. They have a higher incidence rate of assault as a childhood physical and sexual assault, early parental loss, But their behaviors as they grow up turn out to be, again, marked by instability. So individuals with borderline personality disorder tend to have unstable but intense emotional relationships with friends, romantic interests, with their own families. They form these relationships oftentimes very quickly. They can idolize someone after just meeting them. They can have a new best friend or soulmate very quickly, but they can also end that relationship quickly too. And usually the ending of relationships is very emotional and very dramatic. These individuals with borderline personality disorder have intense fears of abandonment, and that's important to remember. Intense fears of abandonment. If they sense rejection or separation, they have quick changes in how they view themselves, and they become very angry at the other person. They can become aggressive with people that they have relationships with, or they can even invoke intense anger in others. So when they sense that a relationship is going bad, they behave very dramatically, very emotionally, and sometimes very aggressively, physically aggressively. These are persons known to engage in self-mutilating behaviors like cutting, burning themselves, or multiple suicide attempts. And oftentimes this is an attempt to manipulate people that they have relationships with. If you leave me, I'll kill myself. I can't live without you. Look what you've done to me. These are people that often sabotage themselves, such as quitting something, like school, just before they finish, or they'll quit a job, or they'll destroy a relationship that just started going well. So there's a lot of sabotaging themselves by quitting something. Now, when you deal with somebody who has borderline personality disorder, somebody said this to me one time, and I thought, wow, that is such a really kind of good description of how you feel. If you spend a lot of time with someone who has this disorder, when you're done interacting with them, you often feel like a wrung out dish rag, like you're exhausted, because interactions with them are very emotionally intense. And the other person, the person with borderline, enjoys controlling the intensity of the interactions. Now, some really interesting movies have, let me see if I have, there we go. Some interesting movies. If you're old enough to remember Fatal Attraction, Glenn Close, the woman who starred in that, great characteristic of somebody with this personality disorder. But more recently, Girl Interrupted, and that's the picture on your PowerPoint. Angelina Jolie and Winona Ryder did a really great job of acting in that movie, and borderline personality disorders talked about and displayed very well in Girl Interrupted as well. So this is the whole I hate you, don't leave me phenomena. That is what borderline really is about. Okay, a little less extreme is called histrionic personality disorder. And these are individuals excessively seeking attention. They're extremely emotional, overly dramatic. They like to draw attention to themselves, really extremely draw attention to themselves, preferring to be the center of attention or the life of the party. Now, these people can appear to be very engaging, interesting people. Not necessarily unstable, like we just talked about borderline. And now, borderlines can be charming at first as well. It goes very dramatic, very fast. Histrionics, it's a little lower key. These are people who can be very engaging, very interesting. They can be very flirtatious or charming. They don't necessarily, like I said, they don't come off as being incredibly unstable, but they tend to be someone who feels everything. Everything. They have very high highs, very low lows. Now, when I say they can be charming or flirtatious, that can often look inappropriately seductive or provocative. And physical appearance to somebody with histrionic personality disorder can be very important, how they look. They don't necessarily have to follow trends, but they like to be different, or they at least like to make a statement. Because it's important to get attention, even if appearing to be just a little bit different than everyone. It's important. It's important to get attention. So this is a group of people that like to express their opinions frequently, dramatically, and sometimes inappropriately. They're going to say what they want to say and have to say, They don't really care how it's viewed by others around them. And their opinions, they tend to be shallow and easily changed, even though they don't think that's the case. Research shows that that does tend to be the case. That they tend to be highly suggestible people, and they become very interested in certain causes or certain belief systems, but again, easily swayed. So they're going to express strong emotions, often in public, by the way, not afraid to express their emotions in public. And because of that, they tend to embarrass friends and family quite easily. They can throw temper tantrums, they can be overly sentimental, and they cry easily. So they exhibit these patterns of intense emotions. Now, the previous personality disorder, borderline, that is more unstable, more unpredictable. And they have more of an intense fear of being abandoned. Histrionic, the one we're talking about now, it's kind of like, very unclinical view, you could say it's like borderline light. But because it's a less intense version of some of these behaviors. Okay, the fourth in this erratic cluster is called narcissistic personality disorder. These are individuals who have a strong need to be admired, a constant attempt to draw attention, a strong sense of self-importance, and a lack of insight into other people's feelings. They're self-absorbed, conceited, grandiose, and they lack empathy. They display feelings of entitlement. They feel they should receive special privileges and respect for all of their hard work, all of their unbelievable accomplishments. They display a sense of superiority. They see themselves in a very favorable light, inflating their accomplishments and undervaluing the work of other people to get them to that point. They view themselves as the hard worker, the amazing person who accomplished this. And by the way, they see themselves as quite unique. This is going to be someone who expects regular praise from others. They expect that, and they're upset if they don't receive that. They prefer to surround themselves with friends that admire them. Their friends are usually socially weaker or unpopular so that they don't compete with the narcissist's attention that they're getting from the crowd, from others. Someone who has narcissistic personality disorder, they do depend on others to verify their self-importance. So they're constantly seeking or expecting this constant contact from the outside world to tell them how important they are. They're sensitive to criticism. They do not take that well. They can fly into a rage quite quickly, unpredictably, fully expecting others to notice their superiority. Being criticized does not go over well. Somebody with this disorder is unable to recognize the needs of others because they talk mostly and think mostly about themselves. Research actually shows that they use first-person pronouns more frequently, I, me, in regular conversations than does the average person. I, me, mine. When they interact with others, unfortunately, they tend to interact with others for selfish reasons. They use others regularly. A final social difficulty of someone who is narcissistic is that they are actually envious of others. They feel that they deserve the good things that happen to other people. So if something wonderful happens to someone else, they're very envious of that person. And they'll spend a lot of time trying to get the attention back on themselves. And they'll often say they should have had that wonderful thing happen to them. And in their world, that makes perfect sense. So that is a narcissistic personality disorder. And really, I think we all know in our lives, we all come across somebody who meets those criteria. Second cluster now, we're in the eccentric cluster. These are ways of being different, eccentric. So 3 here we're going to talk about: schizoid, schizotypal, and paranoid personality disorders. So I'll start with schizoid personality disorder. These are individuals that are detached from normal social relationships. They are indifferent to these social relationships. They simply appear to have no need or desire for intimate relationships or even friendships. Family life is not that important. They don't gain satisfaction from being a part of a group. So because of that, they have few or no close friends. They'd rather spend time alone than with other people. So they choose hobbies that can be done alone, like they choose stamp collecting or model building. They have solitary jobs like a computer programmer, an author, a writer, an artist. Usually experience little pleasure from sensory experiences like eating or sex. So they have little pleasure in those. They display very constricted emotions. Again, not very high highs, not very low lows, very constricted. Appear indifferent to others and to the social happenings around them. Doesn't respond as expected to situations. Kind of passive or bland for schizoid. They can appear often socially clumsy or indifferent, and they don't really respond as expected to social cues. So that's schizoid personality disorder. And by the way, none of these are they're not schizophrenia, and I'll talk a little bit more about schizophrenia in a minute. But this is schizoid personality disorder. The second is schizotypal personality disorder. And this is someone who is acutely uncomfortable in social relationships. So whereas someone who has schizoid personality disorder, they were indifferent, somebody with schizotypal, they're genuinely uncomfortable. They're anxious in social situations, especially with strangers. And if they're spending time with a group of people, they don't become more relaxed the more they interact with that group. They actually become more anxious. When they're interacting with others, they often violate conversation norms. They avoid eye contact. They stand unusual distances away. They feel they're different from others and that they don't fit in. They tend to be suspicious of others. Now, when we talk about paranoid personality disorder, in a minute, you'll see it's much worse in that suspiciousness. But there tends to be that factor in schizotypal as well, being suspicious of others. So somebody with schizotypal is often seen as odd. These words are used often. Odd, eccentric. They may dress very unusually and may appear disheveled. They often believe they possess special abilities, like perhaps psychic, paranormal abilities. That tends to be a very common belief. And they may have unusual perceptions that may border on hallucinations. So the picture on your PowerPoint, if you recognize him, that is a very famous artist called Salvador Dali. And he's kind of a very stereotypical person with schizotypal personality disorder. He has all of the criteria. I don't know if he's officially been diagnosed with it, but people who interact with him think, wow, that is pretty textbook. Tennessee Williams, who was a playwright, he also displayed very schizotypal traits. Now, both schizoid, the first one, and schizotypal are similar in some ways to schizophrenia, which is a mental disorder. It's not a personality disorder, schizophrenia. But the two personality disorders we just talked about, they have more low-grade, non-psychotic symptoms. Schizophrenia, which we don't talk about here, it typically includes symptoms of both schizoid and schizotypal and paranoid personality. It has a little bit of all of that, but it's more intense. Again, these are less intense, and these are personality disorders, not mental disorders, and not psychotic disorders like schizophrenia, specifically that type of mental disorder. Now, paranoid personality disorder, the third and last one in this cluster. This is when individuals are extremely distrustful of others. They see others as a constant threat. So they're not just suspicious, like someone who has schizotypal. They really believe others are out to exploit them, deceive them. And this is even though there's no evidence to suggest that this is so. They become preoccupied with the motivations of others. They're often looking for the hidden meaning, and they often misinterpret social events. They ask, what did they mean by that comment? Why did they say that? Why did they look at me? Did you see that? Did you see the way they just totally ignored me, or what they just said about me or did to me, and the other person didn't pick up on it at all? because it's often misconstrued. They often resent others because of these perceived insults. They're reluctant to forgive and forget even minor altercations. They can carry a grudge. And these are people who, as time goes by, they often become involved in legal disputes. They can be argumentative and hostile when threatened. That is someone with paranoid personality disorder. They can really take it to the extreme. Okay, now the last cluster is called the anxious cluster. And now we're going to talk about ways of being nervous, fearful, or distressed. And the first one is called avoidant personality disorder. Individuals have a pervasive feeling of inadequacy and sensitivity to criticism from others. So because of that, they're going to go to great lengths to avoid situations in which others may have opportunities to criticize them. They may avoid making new friends or going to new places because of a fear of being judged. And because of that, they can become socially isolated. If they do new things, they'll need support from friends. So they tend to stay with old friends, people they know for a long time. And to do something new, it takes a lot of encouragement from their friends to get them to try something. They never want to be the center of attention. No, no, no. And their feelings are very easily hurt. They tend to have very low self-esteem. They feel very inadequate. Okay, dependent. A dependent personality disorder. Individuals seek out other people to an extreme. Somebody with this disorder has an excessive need to be taken care of, to be nurtured, coddled, or even told what to do. They don't work well independently. They need a lot of guidance or direction. And they avoid arguments at any cost. They act submissive, so to encourage others to take care of them or take charge. You're so good at that, I don't know what I would do without you. Please help me figure this out. Those are kind of very submissive ways to get other people to take care of them. They need a lot of encouragement and advice from others. They would definitely rather give up responsibility for things, even their own life decisions, to other people. They're dependent on others. They may tolerate extreme circumstances to maintain guidance or support from others. Like they may stay in abusive relationships, take extra workloads at work, things like that, just to stay in these tight relationships or support from others. So that is dependent personality disorder. The third, obsessive compulsive personality disorder. Individuals who are preoccupied with order and strive to be perfect. So this isn't obsessive compulsive disorder. This isn't the mental health disorder. This is the personality disorder. It's kind of like OCD light. This is just the personality disorder. So let's talk about what this looks like in people. These are people with very high standards for themselves. They tend to work harder than they need to. They desire perfection. They are often very dedicated at work at the expense of their leisure life. They have very few leisure activities, very poor relationships because they work so hard. They may appear inflexible or even stubborn. And they often have a high need for order. Attention to details is very important. They're fond of rules, rituals, schedules, and procedures. Like somebody might rewrite a paper over and over and over. Lose a list and spend excessive time looking for the lost list instead of just simply rewriting the list. They may think there's only one right way to do something. And they often think they have to do things themselves to have it done right. Easily agitated with others when they don't take a task as serious as they do. They can be seen as stingy or miserly. They can live below how they can afford to live. So they spend very little money on themselves. And they may have trouble throwing things away, like hanging on to things, because you never know when you might need it. That's that kind of miserly part of it. Now, this disorder, this personality disorder, it is the most prevalent of all personality disorders. Of all 10 that we've talked about, this is the most prevalent. At any given time, it's estimated that about 4% of adults meet the criteria for obsessive compulsive personality disorder. And again, just to review, this is different than obsessive compulsive disorder, OCD. This is a personality disorder. The regular OCD will have more true obsessive thoughts and compulsive actions. You'll see more repetitive behaviors and hoarding. You can have both, by the way. You can have OCD and obsessive compulsive personality disorder, but you don't tend to see that. Clinicians tend to go, well, if it's hit a certain level, it's really just OCD, obsessive compulsive disorder. It's not the personality disorder, because this tends to be a little softer on the criteria, on the behaviors. It's like OCD light. Okay, so those are the 10 personality disorders. And by the way, it's often easy to meet criteria for multiple personalities disorders. Now, to having a narcissist who also has borderline personality disorder. And you can see that, as a matter of fact, it's pretty common. Several contain common features, as you just heard, and clinicians will search for one so that they can make one diagnosis, but sometimes that's difficult and the person clinically meets the criteria for more than one. So you'll often see people with more than one personality disorder diagnosed. And that is the chapter.